let's move on to the next part of the next section.
Yeah. Thanks so much, Dr. Bowman. We have a lot to think on. And it was a great way to sort of set up the conference and mentorship and thinking about collaboration. And I love the last point of you can have diversity and excellence. So we're going to talk a little bit about our AGMHI work groups in the next hour or so before lunch. And this is what I mentioned earlier on. This is going to give you a snapshot of what everyone's been working on. And so for those of you who are not involved in a work group, this is your opportunity to hear about what they've been up to, and also thinking about in the breakaways in the afternoon, maybe which group you'd like to go to and learn a little bit more about. And then moving forward, become more involved in the work groups overall. So they've been meeting since 2020 to develop strategies for each domain of the AGMHI. Each work group today is going to provide a brief update on their progress, the challenges, and sort of the way forward overall. So we're encouraging any new members or any people after you're hearing today of what the work groups have been up to and what they're working on, for you to email agmhi@bmc.org. It's agmhi@bmc.org if you're not already in a work group, and you'll get on the listserv, and so then you'll understand all the updates and when the meetings are happening, so that you can become more involved. So first up is going to be our research work group. Laila, Asmal, Atwale, and Senait Ghebrehiwet. Did I say it wrong, Senait, after all of these years of knowing you? Ghebrehiwet, I got it right that time. And so two people are coming up today to speak for that work group, and so I'll let you guys start first. You want to come up?
Good morning, everyone. I'm still quite paranoid about this COVID thing, but I think there's this invisible COVID protector in front of me now, so I'm taking off my mask. All right, so let's see if I can figure this out. No? Yeah, okay, so we've got a really exciting work group, lots of members, lots of different voices, and it's been a pleasure being part of it. I encourage those of you who are at all interested in research and capacity building in research to consider joining. This is our team. Not everyone will be able to be here for the Congress, but after the conference we're going to be meeting for feedback, and hopefully by the end of this time we're going to work on a potential proposal for a research grant. So I've chaired the research work group, I think, for this year, and we started off by setting some goals. You know, leadership must have vision, etc. So the goals for the year was, firstly, we really thought that mentorship is important, as Jimmy said, and we wanted to look at the feasibility of a mentorship program, and then if it's feasible, to subsequently develop a research mentorship program, and Senait will speak a little bit about that. We also had the goal of developing an up-to-date and utilized research resource folder for our work group members. So it's good having a resource folder, but not so good if nobody uses it, so that's something to think about. We also had the third goal of developing a workable and sustainable research project across African centers. And finally, to identify research skills that are needed in geographical areas with limited resources. And that's our goal for the second half of our tenure. And I'm not really going to be speaking too much about that, just the first three goals. Jimmy, this is really confusing, this thing. Yeah. There's two buttons, but I can't get it right. I'm with you. I don't know where I am anymore. Okay, all right. So, the progress and goal number one regarding research mentorship, I'm handing over to Senait. Here's this evil.
Before I summarize this, I just want to acknowledge that Dr. Atwale also chaired this group early on during the pandemic when we were all trying to process what was going on and how to collaborate with one another. I think he'll be joining us later, but I just wanted to acknowledge his leadership in this group as well. So as we heard earlier, mentorship is necessary, and so I think pretty quickly this research working group identified the need for a formal mentorship program specifically around research that matched mentors and mentees. We weren't aware of that existing or being widely available, and so I think that's our first order of business, it seems like. So we've created a subcommittee for this research mentorship program, which is in development right now. I think at this point we're thinking it will be a 2-year program, primarily virtual, so it's accessible for folks around the world. It's really to help emerging African mental health researchers who are up to 10 years out of training, so that's kind of the target, and matched up with senior faculty who are leaders in the field anywhere in the world. Like I said, mostly a virtual program with various components that I'm sure we'll kind of share with everyone when they're ready to be shared. But really, the primary part of the program will be one-on-one meetings with the mentors and mentees, I think on a monthly basis, and including creating a formal career development plan so that by the end of the 2 years, mentees have a clear strategy of how to move forward and grow. And ideally, some networking will be included in that, so attending this conference, hopefully other meetings that are happening on the continent for the mentee to kind of connect with people and grow their network. So just some brief challenges that I think we're working through, but that have definitely been identified. So we're currently talking about what the exact framework will look like, eligibility criteria, the length of the program, what feels feasible and sustainable, and of course funding. So at this point, I think we're starting small with a pilot, just a handful of mentees just to see how that goes first before we scale up. And so hopefully it will be successful, and we can kind of work out the kinks in this pilot and then scale up and search for some donor funding to really take on more mentees with each passing year. We've been talking through some of the challenges around incentives, both on the mentor and mentee side. So for mentors, we've been thinking about what is a feasible incentive that feels worth it, that acknowledges all the time and effort that one is putting in, but that's also possible for us to keep the program sustainable. And then what are reasonable outcomes for mentees in a way that feels like we can standardize across the program, but still leaves room for your career development plan to be tailored to you and your specific needs as a mentee. So that's where we're at so far, and I'm sure we'll share more information as we continue to work out some of the details for this. But once we actually launch it, we hope that many of you will apply and take part in this. Thank you.
Okay, hopefully that'll be the next year we'll be launching. Okay, I'll just speak briefly about our research resource folder. So we're going to have a session on the resource hub of the AGMHI a little bit later, and so we're going to be piggybacking on that. We're hoping to get a database of members, affiliations, grants, research interests, so that we can link up. Because I'm just looking at the program now, surprised that there are people doing psychosis research in Zambia that I was not aware of. So this is, I think, a central kind of hub would be really important. And then the sharing of things like biosketches so that people know how things are done. I think that's important. And of course, it's only useful if it's used. So we do have a resource folder right now, and I don't know how much is being used, so we're going to have to kind of look at that. And it needs to be kept current. No use having a biosketch from 5 years ago, and the sustainability of that, I think, is a question. But I think that's going to be part of a bigger discussion. So our research project, and we're not going to be deciding on that within the work group alone, because I think there's a lot of people interested within the AGMHI in research, but are not members of the work group, and that's why we're having this kind of powwow session later on today to discuss that. But this was a grant that was spearheaded by a number of members of the AGMHI, and Dr. Kolo, I think, was one of the key ones, and this preceded my time, and this is the feedback that he gave. So it was a grant proposal that was NIH. It wasn't NIH, was it? It was action-based. NRF, NRF grant. And it was looking specifically at COVID-19 and the prevalence of common mental health disorders among healthcare professionals in Africa during COVID-19 pandemic. And a lot of work was put in to this, and there were a lot of collaborators that came in together to develop the grant proposal. And really, when there's a lot of different collaborators in, I think one of the take-homes, and that's for the later meeting as well, is that you need institutional support. It's not just the people involved in the grant applications that you have to have buy-in from. And then if there's 5 different collaborators, 5 different geographical sites, it gets challenging, and especially with time zones. And then when it's just an acknowledgement that research for all clinician researchers, but I think especially in Africa, it's very low down on the priority list. You have to kind of really fight for that space for research. And with the COVID-19 pandemic, it was really hard to find that space and difficult to maintain momentum. And of course, that grant collaboration, I think on reflection, you have to choose a grant proposal where you can be fairly certain of sustainability on the topic. And ideally something that we know has been a challenge within our kind of location for a long time. So that inevitably the first application fails, and you're going to have to keep at it and have buy-in from subsequent members. So successful grant application take careful planning and collaboration, and need coordinated efforts, interested members, and proper institutional support. We really have to think deeply about whether we have both the motivation and the support and how we can get both. And we're going to take back our feedback from the in-person work group, research work group meeting today, and have a post-conference meeting with the rest of the research work group. And that's a challenge, virtual versus in-person. And the final thing that we have right now in our work group is the first 10 minutes, which is starting it. The first 10 minutes of every meeting will involve one research work group member just talking about their research. Because we don't really know. We come in and we have these preconceived ideas about how we can bring together research in Africa, but nobody knows what anybody's doing. So that's the first step. That's it. Give me a choice.
Thank you both. We're going to reserve questions at the end for all the work groups. Hopefully we can get through so that you can at least hear what each work group is doing. And so the next one is focused on training and education. It's led by Michaela Wusu, Sam Opaku, and Gordon Donnir. Gordon's here today to talk a little bit about what they have been up to.
Hello everyone. I'm here presenting on behalf of the Training and Education Group. As we have it in Australia, at every meeting, every conversation, we do acknowledge the traditional owners of the land. So in the same spirit as Jim has mentioned, looking back from where we came from, I want to acknowledge the traditional owners of the land that we are meeting on, past, present, and emerging. And the group is co-chaired by Michaela and Samuel, but they're not here. So I volunteered to step in, and I'm just going to do just that. It's really confusing. So these are members of the group, and we cut across from various spaces, and as you can imagine, having meetings at my time at 2 a.m. or 1 a.m. So the goals of this working group is really to develop training and educational tools to be delivered across the continent. to support young and emerging psychiatrists by setting up residency programs for mentorship and networking. It looks like mentorship is winning the day today. Yeah, it's featuring across board. And to, more importantly, establish international collaborations, which have been known to be a very important and powerful catalyst for researchers on the continent in terms of resource availability and access. To develop a training program, a training and education information sharing hub. So those are the objectives of this group. And on our first goal, to develop training and education tools, we've had a global training and educational opportunity survey, and then the training and education trauma model, which we've put together a curriculum of a sort, and the various topics is listed. We talk about what constitutes trauma. As you know, a place like Africa shares quite a lot with places like Australia, where intergenerational trauma has been transmitted from one generation to the other. And I think that Jimmy mentioned that in the light of the inequities that exist. So we thought that it would be a good starting point to talk about trauma and ongoing trauma on the continent, especially in conflict places. So a number of a host of topics that has been proposed, and we've thought about how that curriculum can be achieved. On goal 2, that's setting up residency programs for mentorship and networking. We thought that was an extension of the research working group, and to collaborate with the research working group as to how that can be delivered across the continent. So international collaborations, we thought we would collaborate with the APA and the WPA, collaborate on funding opportunities with fellow working group members, and use the working group's interests from different countries to collaborate on an NIMH and targeted grants, so that we can write some collaborative, we can work together to present grants applications. To source working group interest by sharing our CVs and various sketches, which has already happened, but I'm not sure if everyone has submitted their various sketches. So goal 4 is to develop training and education information sharing hub. So that we haven't done much on so far, but I think there's opportunity to talk about it. So the challenges we identified are the overlap of some of the things. As you saw, we talked about collaborating, working collaboratively with the research working group, because there are kind of overlaps with the various working groups. So, and the challenges and benefits of an inclusive multidisciplinary approach. So for example, the curriculum we talked about on trauma, we're looking at how it can be delivered in a multidisciplinary way, from across social work, psychology, psychiatry, and so on. So those are huge challenges that come about because people are looking at trauma through different lenses and how they approach this management. So it's one of the things that we hope to be working on. The way forward is to hold at least 2 trauma sessions within the next 9 months to be delivered. I think we're still discussing the mode in which it will happen, especially utilizing the various multidisciplinary expertise on the team. Thank you very much.
Thank you, Gordon. So the first 2 that just went, research and training and education, are the 2 work groups that their focus in the breakaways will be on a funding opportunity. I mentioned that earlier today, but I'm going to reiterate it a lot so that people start looking and thinking about it. It's in page 32 of the booklet where the funding opportunities are for both research and training and education. The next two, clinical care delivery and advocacy and policy, when we do the breakaways later, will really focus on strategies, topics, and the approach to do the work moving forward. So you won't see funding opportunities, but there'll be a different framework for those two groups. Clinical care delivery has been led by Anusha Lachman, but I understand she's the infant whisperer, is that right? And then Tashome Kelkile, and Anusha is here to talk about what they've been up to.
Thank you. I don't know where this infant whispering came from. I do feel like a fraud because I'm hardly a researcher. I think it's good that I head this group, which is I'm a clinician first. And so I'm really pleased to be able to head this clinical care delivery work group, and you'll see our bias soon. The active work group is literally myself and Tashome. So I'm just going to talk on our behalf and to really try and advocate for people wanting to join our group, because I think that we're trying to focus on a slightly different angle, which is not just on research and funding, but really trying to appeal to the need, which we think is quite great on the continent. And so the idea that we came up with in terms of objective broadly is to develop clinical resources, so by clinicians, for clinicians. And which suggests really what is the next best practice. Because what we really have found in our clinical space is that we have lots of evidence-based guidelines, and they're always research-informed, which is what's needed. But really we are on a continent where practicing the gold standard is not always possible. And while we want to keep as close to the gold standard as is possible, sometimes there just isn't the resource. Or human or otherwise. So that was really a big objective for us. And we started off before COVID cruelly stopped us in terms of trying to practically understand what this meant. And so there was a call that came out of the African Association of Psychiatry on the continent, basically asking for updates in the textbook. And I thought this might be a very good starting point for a clinical care work group to sort of re-evaluate this chapter and say, what is it that we could put together as the next best thing? So that if you were sitting in Uganda or in Tanzania and you didn't have a psychologist to offer 10 sessions of CBT for depression for a child, could you actually give an SSRI? And what would the evidence tell you around that? And so we really were thinking collectively around how clinicians could think about a particular topic, how you could approach it and apply the next best thing. And so the chapter was called Child and Adolescent Psychiatric Disorders. The bias here is because I'm the infant whisperer. And we had contributors from UKZN, from Lagos, and myself from Stellenbosch University. And so what we tried to do was look at an approach to how you screen children, what are common things that occur, and what's a collective list of what are the evidence-based interventions that work and can be applied. And so we aim to not just reiterate or regurgitate DSM criteria or categories, but rather to say, if you're in a limited resource setting, what can you do? How do you manage people effectively? And how do you consider the service challenges in that setting? And so we submitted it, but obviously COVID happened and we didn't really have feedback from the AAP again. So we're following up on that. One of the goals that we really were focused on was really how do we incorporate now the advancement of technology and how do we increase training opportunities? So again, overlapping a bit with the education and training work group. And also the second goal would be then how do we diversify the membership here so that we can include broadly other subspecialties, countries of residence and group of study. So the progress on goal 1 was really, they started off, Tashome was involved in this, where a survey was created to collect information from the AGMHI members with their interests in shared opportunities and to basically ask what would you like more of. Unfortunately, there was not a great response to that. There were only 18 responses collected. And we had difficulty getting feedback from members of the AGMHI, and we're still trying to really get our heads around what's the best way to collect this information, and hopefully we can chat a little bit more in our breakaway session. A really exciting collaboration though, which I think we might be onto something here, is a collaboration with an existing work group which is called Essential Medical Guidance. So it's EMG, and it's this wonderful kind of tech support that's created by these two medical officers who were on the Forbes top 40 under 40 in Africa, that were recognized as clinicians who wanted to really expand clinical reach across the continent. And they created this EMG app, which is available free of charge, which is basically the QR code that you can download, and it's on your phone. And they basically worked for MSF, and they went across to rural or hard to reach places in Africa and war zones, and they tried to create these little guidelines or little videos of what to do if you were the sole clinician stuck in a war zone and you didn't know how to reduce a fracture. So they got orthopedic surgeons to video a small, short snippet on how you could reduce the fracture if you had nothing else there. And I thought that's a really good opportunity for us to be able to get in from mental health and to be able to progress on that and to reach people across the continent where you could download things which didn't require data when you were offline, and you could always access it. So we appeared to share common goals. We've had a meeting with them. And they're really keen to work with us in terms of what could be used, what's the best method, could it be podcasts, is it just guidelines, could we have talks, could we have interactive sessions that clinicians could access. So we're signing an agreement at the moment with them, and we're trying to sort out the legal issues there, and we're trying to identify collaborators for podcast series. So that is really what I'll be focusing on our work group today in terms of ideas and how we package them and what would be most effective. And we look into funding. The challenges of this has really been about identifying the need. Who would be tasked to do this, what platform, and I'm hoping that this work group represents something more than just child and adolescent psychiatry, although that is the kind of leading need on the continent. And we really want to diversify in terms of content, but also partnerships. And getting onto that diversification of membership is really about diversifying members. So I'm hoping that people from other subspecialties within psychiatry are willing to be part of this. We really couldn't do this because a lot of people go into the more attractive subgroups, which is really about the research and the education and training, and really the clinicians at the ground are always literally holding the baby, aren't we? So I'm hoping and pushing that people join this group. So for today, I really hope that we can recruit more core members, that we can identify ideas of potential interest for collaboration, and that we can also then alongside think of grant applications later on. Thank you.
Thank you, and last but not least, our advocacy and policy. It's led by Tedla and Greg, and then Rick Wolthusen is here today, and so he'll come up and talk a little bit about that.
Okay, before I talk, I might need to shut quick explanation of the pointer. The middle one. All right, here we go. So good morning, everyone. My name is Dr. Rick Wolthusen. I'm a third-year psychiatry resident at Duke University. And I've been working with the Advocacy and Policy Work Group since earlier this year. First of all, let me just say how wonderful it is to be in the same room again. It has been really possible over the last couple of years. I know I've been Facebook friends with some of you, and I knew what you look in 2D, but 3D is much better and appreciated. Dr. Lachman was just talking about the less attractive subgroups. I would also consider our less attractive subgroup. We only have currently 7 active members. I think even fewer than you guys have. But nevertheless, let me talk about what we do. So we have 3 objectives and goals, as you can see here. We kind of like, I think the overall arch is like to say that, whatever we think about, whatever other institutions think about, we don't want this to be in a shelf, right? We don't want this to be, it's nice to have, it's a document, but how do we use it? And it goes back to your point, right? Like the usability. And so our first objective really is the development of policies and advocacy strategies that actually can go out and can be used by community members, develop curricula that can be used, and then also to have strategies for resource mobilization to make this happening. But before, I know there were videos of Dr. Fitchi and Dr. Tanner. Are you coming?
Should we play them now?
Yeah. Let's just let's just hear from both of them before we continue with the content. We just wanted to send a quick hello and also give you some background as the co-chairs of the work group before we continue with the content. And I'm not pressing anything, so.
Good day to you all. My name is Ghebrehiwet. I'm Associate Chief of Psychiatry at Massachusetts General Hospital and Professor at Harvard Medical School. I'm serving as Chair of the African Global Mental Health Institute Advocacy and Policy Working Group. I'm sorry I can't be with you in person today. My co-chair is Dr. Pedla Georges, a close friend of mine and a colleague, and you'll be hearing from Dr. Georges in a few moments. The Advocacy and Policy Working Group aims to broaden the understanding of how bureaucratic processes work in policy amongst stakeholders and advocates for mental health awareness across the African continent. Members this year, and we have a very small group. We started out with about 8 members and we're down to 5, so please consider joining us. We have one major goal for the year, and we want to focus on developing a toolkit repository that can be used as a blueprint to guide members to affect policy and advocacy change. And we also want to identify champions and advocates in each African country for mental health. We thought that for the purpose of establishing a toolkit for policy and advocacy, we would first do a survey, and we have completed that survey, and you'll hear more about that in the breakout working group session later, which will be chaired by Dr. Rick Wolthusen, who has really been a prominent member of our working group, really a thought leader in policy and advocacy. In terms of establishing a toolkit repository for policy and advocacy, we are focusing on 2 major themes. One is a framework of competency and skills for policy advocacy work, and that has been contributed by Dr. Georges, who has enormous practical experience with the Ethiopian Ministry of Health, working hard to establish mental health policy. He is an extraordinary advocacy for mental health in Africa. And you'll be, as I say, you'll be hearing from him in a moment. And then we also are focused on something called human-centered design, and Dr. Wolthusen will be presenting a model in depth at the breakout session later today. So with that, I'll just sign off, but I hope you have a wonderful African Global Mental Health Institute meeting, and I'll see you again down the road. Thank you.
All right, I think there's a second one coming. Dr. George, here we are.
Good day to all colleagues and participants. My name is Dr. Georges, and along my longtime good friend Greg, or known as Dr. Fischel, and the co-chair of the working group on Advocacy and Policy Working Group of the African Global Mental Health Institute. That's also been a pleasure to work with other members of the working group, especially Rick Wolthusen, who ably compiled our work and who will be presenting to you at least what we have done so far and what we're planning to do. Thank you, Rick. And I want to assure you that we're going to be there with you in spirit. Now, since Greg has already aptly described the working group's effort in its brief message, my message to you will be simply revolving around the importance of promoting smart advocacy and smart policy on mental health in Africa, which historically has received very little or no attention. Well, at the conference, there will be many important presentations on research and findings, which are important. My brief message now is based on my decades of experience in the area of promoting advocacy and policy in Africa, especially serving as an advisor at the Ethiopia's Ministry of Health of the Minister, and also in the US on the advocacy and promotion of policy in terms of the provision of services to the underserved ethnic and linguistic minority communities with 4 decades of experience. Now, first and foremost, let me remind you all that as mental health professionals, we have to remember that whether we're located in Africa, the US, or Europe, or Africa, stigma is associated with mental illness. For centuries, the mentally ill were treated like criminals and or possessed by the devil, locked up, chained, feared, and distrusted. Of course, there have been a lot of improvement and changes, but however, in a way, not much has changed, especially up to par with what should be in the 21st century. Therefore, I do believe we should never forget that our efforts to promote mental health has been and will continue to be an uphill struggle. It's not going to be easy. Therefore, we should calibrate our expectations accordingly, saying to ourselves, it's going to be challenging, it's not going to be easy. Second, the recent World Health Organization estimates of the global burden of diseases of mental, neurological, and substance abuse disorder indicate 10%. Again, 10% make up of the global burden of diseases and 25.1% of non-fatal diseases in terms of the global burdens of diseases. And just a year ago, in 2021, the Director General of WHO, my former boss at the Ministry of Health, also stated, quote, let me quote what he said, "It's extremely concerning that despite the evident and increasing need for mental health services, which has become even more acute during the COVID-19 pandemic, good intentions are not being met with investment. We must heed and act on this wake-up call and dramatically accelerate the scale-up of investment in mental health, because there is no health without mental health." How true. Therefore, our working group will be focused on developing tools to promote smart advocacy, smart policy, and smart resource mobilization. Just simply research, statistics is just not going to do it all. We have to work smart, not only hard. Therefore, let me just wish you all a pleasant stay in Cape Town and a productive conference. And I wish I was there. Good luck, everybody. Bye.
thank you to both of them, and we wish they were here too. But let's use the last 5 minutes of this presentation to actually walk you through some of the objectives and the way forward. So we did a survey as well. Our N was also 18. So I wonder if the same 18 people who responded to the education work, the clinician work group also responded to our survey. Same struggles. We also want to bump up the N, but this is where we currently are. We do want to acknowledge that whatever we do, of course, will never be sufficient to be applied in 54 African countries. However, we do think that we could come up with a blueprint, so to say, of action steps or like thought questions. Basically the social innovation toolkit of what steps can people think about, what can they do, what questions should they ask, right? What are the pain points, like what do people really move forward? And I think this is the good thing about pain points is people everywhere feel these pain points, right? And if people feel pain points, they are inclined to make change and move forward. And so basically this is what the social innovation toolkit is about, which we'll talk about this afternoon in more detail. Also, I saw in the conference booklet, I think it's on page 34, that there's a schedule of the upcoming conferences happening on the continent over the next couple of months. And so we will also talk about the social innovation toolkit at a conference in Tunisia in December. Actually have a whole day workshop there as well. Okay, here we are. Oh, there we are. So the way forward on goal one, as Dr. Fitzgerald was saying, we are identifying mental health champions, right? Because again, it's not enough to have a toolkit, but we also want to have people championing it. We do propose that there is a social innovation workshop at next year's African Global Mental Health Institute conference. It could be like a 3-day workshop if there's interest. And then we also want to obviously apply the social innovation toolkit and mix it with case studies from different African countries, right? So the social innovation is basically, it's a process, it's a 6-step process where you have empathizing, innovating, ideating, and so on. And so really they have so many wonderful projects been done on the continent, and they have been showcased before, but really we want to put them in context, and at each step of the journey we want to make clear, why they worked and how it can be replicated elsewhere. And then there are social innovation hubs who do nothing else than design thinking or social innovation thinking. They are all over the continent, particularly in Tunis. There's one in Accra, there's one in Nairobi, and there's actually one here in Cape Town. And so these are wonderful opportunities for us to collaborate with them in their respective regions so that we can actually bring design thinking to the regions and not only to certain countries where these social innovation labs are. The second goal is really acknowledging the fact that most of us in the room, we are trained in medicine, or we're trained in psychology, or we're trained in social work, or whatever respective discipline we are in. But being trained in medicine or psychology is not enough to be an advocate. But being trained in medicine and psychology is not enough to be effective with grant writing, understanding the economy, and all these core skills which we need to have in a policy and advocacy field. And so that's why Dr. Tedler came up with the idea of this competency skill toolkit, which we talked about this afternoon, right? Because it really needs to be, we need to be a medical doctor plus X. And the plus X is really important, and the question then becomes, how can we add this content and this education to our existing education? And so this is something we are going to talk about this afternoon as well. And the way forward for this is that we are, have a list of competencies and core resources which we want to share, but we also want to hear from you. We're also looking into funding opportunities. Maybe we do it with webinars with the African Global Mental Health Institute. Maybe you're just adding it to existing educational webinars. And then also, the idea and the point was raised, right? We don't want to compete with clinical duties because you understand clinical duties are the most important, but also we still think that in the policy and advocacy space, it's important to have this additional training. Lastly, goal 3, if I get there. Here we are. Resource mobilization is of key importance. It is what it says it is. It's getting the money to actually implement some of the activities we have been talking about. We do have 2 work group members, as you can see here, point 3 and point 2, of people who are working in institutions who we might be able to partner with. But also we are looking into connections with other potential funders, and here's just a list of groups we are looking into. There are more, so let us know if you know about more potential funders. But really here, I just want to finish with making a plug about, we are a small group, Greg was saying we're currently 5, so the last picture could be you. So please come join us this afternoon, and we're looking forward to the discussion. Thank you.